How's it going, guys? My name is Dr. Hamilton, also known as Dr. Silvertongue. And thank you for following my series that basically goes over me doing house calls and experiencing patients and talking about their injuries and talking them through how to recover from it. And today we have
Lucy.
Aaliyah.
Okay. All right, we're going to get started. All right, Miss Lucy, tell me about your problem.
I get this like ache on my lower left hip. Mm-hmm. And I usually get that pain when I go running. So by like the second mile, it starts to ache. And once I'm done running, it's just like it just feels like it's compressed on that side. And then I have acid issues.
How long you been dealing with that, the low back thing?
I think it's been like 4 years.
It's a really long time. Okay, it started when you were running, or was it another incident that caused it?
Yeah, I think what caused it was like weightlifting. Like the posture wasn't right, but also like while running. Because I was doing those two things at the same time, so I don't know where it actually came from.
Hey, what do you typically do to help with it?
I stretch.
Okay.
But that's pretty much it. I don't do yoga.
Okay, good. All right. So, all right, now going to the acid reflux. How long have you been dealing with that for?
That, it just started to get like really bad in the past like 4 months. Yeah, like I started to notice that like it's just gotten worse.
Okay, what usually triggers it? Is there?
I think it's like just if I eat like hot sauce or you know like a lot of tomatoes, like acidic foods. I feel like that's what triggers it. So I've been trying to stay away from it.
Okay.
And then also like not drinking coffee in an empty stomach. So I try to like eat yogurt before, but that's not really helping.
Okay. All right.
So I think I'm linking it to like the misalignment.
Okay. All right.
Yeah.
You usually have like back pain too when it's happening too?
No back pain.
Okay.
No back pain. Just like it's just I've been burping and I'm like, why do I keep burping?
Yeah. Oh, all right.
That was like gross.
Any trauma in your life? Like any car accidents?
Yeah. Had a car accident probably in 2021. Like broke a rib.
Okay. All right. That's not fun. Okay. Which rib?
10th right.
Let's run an exam for you.
Okay.
We'll do. Yeah, you can. We can get you out the way. That's fine. Let's see. You ever get any neck pain too?
Yeah, but I think it's like linked to work.
What do you do for work?
I'm a dental hygienist.
Oh, so a lot of looking down.
Yeah, but I recently got ergo loops, so I don't do much of neck bending anymore.
Okay. What is ergo loops?
So it's like how I like to describe it is when you're in a microscope, you're looking straight, but it looks down at a specimen. So it's kind of like that. There's no like tilting or anything.
Okay. Is that like popular amongst the dental hygienist profession?
Yes, you definitely need it. So it magnifies the teeth.
Oh, wow.
The loops magnify them.
All right, let's have you go on your stomach.
Okay.
Okay. All right. So first thing we're gonna do is check the feet.
Okay.
So we can see the right foot is about an inch shorter than the left. And
An inch? That's big.
yeah.
It's huge.
Let's see. And it feels like the hip is coming up a little bit. So that's definitely something that we want to work on.
Yeah.
Shift it back into position.
Yeah.
Let's see. Is that painful at all, coming up like that?
No. It's just you're giving me a good stretch.
About right here.
Oh, it sounds more limber.
More limber, huh?
Feels more flexible.
Let's see that right there.
But I guess when you did go up, I felt like a
Yeah.
stretch, strain. I don't know.
Let's see what we got. Yeah, it feels a little bit tight down here. Not necessarily moving too great. It's your paraspinals, but also your SI joint. And let's see what we got up here. And yeah, it looks like the spine is like coming up. It's a little bit tilted,
Yep,
like
yep.
shifted to the right.
Yep,
So
yep,
this
yep,
is
yep.
Certainly something that
That's
we want
the
to work
X-ray.
on. Shifting back into position. And yes, you're not too far off.
I'm not?
In terms of that gastric problem that you said that you're dealing with, like right here, that's like T3, T4 area, like whenever that gets out of alignment,
Yeah.
the nerves that go to the stomach come out of that area, and they can affect, the stomach and have gastric problems. That reminds me of my one patient that I had from France. He was dealing with like severe gastric pain, and he ended up going to all these other healthcare professionals to help with his gastric problems, and he was dealing with it for like 6 months.
Wow.
And after seeing him and checking his alignment and adjusting him, after a few visits, it diminished completely. All his gastric problems, which is great.
Oh my God. Okay.
Okay, let's see. First thing I'm going to do is I'm actually going to open up the cervical thoracic area. So it's like where the upper part of the neck turns into the mid-back. A lot of times when that gets restricted, that can cause a lot of difficulties with movement, especially if we're looking down all day as a dental hygienist. But let's see. Let's open this up. Nice. Open this up over here. A smaller one, but that moved pretty well.
Yeah.
Okay. And yes, it is good to stretch out the leg, because whenever the legs get really tight, it can cause a lot of stiffness in the back. So let's see what we got right here. Let me know if it's too much. Okay.
So good.
And this one right here.
I felt so good.
Yeah, that's pretty good. Let's get you on your side, facing towards. Actually, before we do that, we're gonna do what's called a drop table, and that actually helps with the misalignments with the hip.
Okay.
Come down a little bit to the foot of the table.
Like that.
A little bit more. Right, let's get you on your side, facing towards me.
Okay.
Let's open this up. Okay. Come a little bit closer.
This way?
Yeah. And you can relax this. And now we're gonna get the low back. Help shift those vertebrae back into position. Take a deep breath in. Breathe out. There we go. Bye. When's the last time you've been to a chiropractor, actually?
I went to this guy 2 weeks ago.
Oh.
Yeah.
How often were you seeing him?
I only saw him once.
Okay.
Because my friend referred me and she was like, oh, you get a free treatment if you just go and get a consultation.
Oh, huh. Gotcha.
Because then she referred me because she's an established patient. So she just got me in.
Oh, well, there.
I'm like, okay, cool.
Come a little closer. Let's see, you can relax this. Take a deep breath in, breathe out. Nice. Okay. We'll have you on your back.
Okay.
There you go. And this up here, so we'll stretch out the legs. A lot of times when the hamstrings get really tight, you can pull on the pelvis, which pulls on the back.
Oh.
And that can become problematic, which could be a reason as to why we're experiencing that when we're running as well. What mile did you say?
Like by the second.
The second mile? Okay.
But it's gotten a lot better. I think it's yoga.
Okay, good.
Oh my God.
Sick.
That was a good stretch.
Let's see what we got right there.
Making sure there's no camel toe.
I'm sure the camera lady will help us out with that.
You want to?
Listen. So now we got to get the glute and the TFL, because that works with the hamstring to pull on to the low back as well.
Yeah.
And then we're gonna do the other side as well. Just don't want to walk around the other side of the table, but a little bit tighter on this side actually.
I'm like breathing through it.
Talk you through it.
I'm breathing it through it. I'm like, oh shit.
Relax this.
Yeah, I just feel like this one's tighter. Do you think it's because it's shorter?
It certainly can contribute towards it, having a shorter leg, but definitely having tight legs, that's something that we want to work on, loosening that up.
Right.
And making sure we stretch pretty thoroughly.
Yeah, I've been trying to do yoga twice a week.
Come down, is it? Okay. Let's see, big hug. Breath in, breathe out.
Oh, that was so good.
Okay, let's see what we got up top. Relax, relax.
Okay.
Let's see what we got up here.
Well, you didn't talk me like through it.
How so? How am I supposed to talk you through it?
You're like, okay, you can stop hugging yourself.
That's me talking you through it.
Mm-hmm.
Okay. It's a little bit tight up here.
It's super tight.
Constantly.
Yeah, it's like working with like my shoulders, like, doing a lot of this pulling.
Let's see what we got here. All right. So a lot of times what happens is levator scap can get really tight up here, and that pulls on the area of the bottom part of the neck, and that can cause a lot of, sometimes people can get headaches and things like that as well, but it's good to make sure we stretch that out. We can go over some stretches like after this as well.
Yeah.
But drug your shoulder up towards the knee. Yeah, just like that, actually. All your strength. Oh, you got a lot of power. And relax it. This is a good way of stretching out levator scap. And also upper trap as well. Let's see. Okay. Do it again. You can relax it. Let me know if it's too much pressure.
No, you're good.
Let's do it there.
That's good.
Shrug your shoulder up this way. 3, 4, 5, 6, 7. And you can relax it. Okay.
Feels so good.
Yeah. Okay. Tell me the story of your craziest patient that came in as a dental hygienist.
Craziest?
Yeah.
There was this lady that, it was the first time I worked on her. This girl starts crying. And I was like, what's going on? Tells me the whole tea. She says that she's married, but she's like hooking up with some guy at work. And she termed it like he groomed me. I was like, girl, I don't think you know what grooming means, right? It's like it's not like she's a virgin, but I don't know, I think he's like older, but he's like playing with her and she's literally like crying because she's just, I don't know, losing her shit. She has like a husband living in some other state and then basically two-timing him.
Wow.
But she's literally opening it up about all of this in the chair and I don't know how to handle it because she's crying. I was like, what is wrong?
She thought it was therapy, huh?
Yeah. Usually that's what they be thinking. I mean, it is kind of therapy for me too, though.
Yeah, it is.
I'm like, my life could be worse. Like, I have it good over here.
Getting all the tea?
Getting all the tea. Honestly, I live for the tea with my patients. Like, screw your hygiene. I don't know what's going on in your life.
Let's see. Alright, so we're gonna get the upper part of the neck, C3, C4 region. Nice. Okay, get this one right here. Okay, you can relax, drop your head. Okay, that's good. All right.
Wow, that feels so good.
And let's get those ankles, actually.
Oh, you have to take them off?
Yeah.
Yeah.
Your shoe might, well, I mean, damn. I was going to say your shoe might fly off, but this thing is like all locked on there. I'm like, I guess it won't.
I know, yeah.
All right. Let's see. There you go. Bit of a tight spot, but let's see if we can get it.
Yeah.
There you go. All right, and we can get knees too.
I was like, did you stretch the right leg 1 inch?
There you go. Yeah. So the phone died. Or storage, we ran out of storage somehow. We got a lot of good cracks, I promise.
Very good. Very
Okay,
good.
so let's go over some stretches like for your hamstrings.
Yeah.
Some good stretches would be this one right here. You basically bring it to your chest as much as possible.
This?
There you go. And loosen up the hamstrings. Like I said, loosen up the back. So what you could do is, if you want to make that more intense, you bring it closer. Less intense, back it off. But essentially what you're going to do is you're going to do some pumps. So you're going to do like this.
Oh.
And then you bring it down this way. So up
That feels
and
good.
this way. And then you do that roughly 20 times to help loosen up the
Wait, that's
hamstrings.
good.
Yeah, it is good.
Cool.
And then
You're like, I
you
know
would
stuff.
do both sides. What you said?
You're like, I know stuff.
Yeah. No, I know a few things. Not everything, but I know a few things. I know how to fix it back.
Yeah.
All right, so come up, and what you can do is face that way, and then